Assalamu alaikum. I am Dr. Maria. There has been a cyclone formation in the Arabian Sea from few days, and that is why I thought we should talk about it so that we know what to do in that case and try to stay safe. So, what is a cyclone? A cyclone is a continuous movement of high intensity winds in circular motion around an area of low atmospheric pressure. Even the coastal areas are going to face high intensity winds between 60 to 80 kilometers per hour, and the waves that may hit the coastline may go up to 6 to 8 feet high. So how do we know that this cyclone is approaching? The first indication is the formation of high waves that are developing in the sea, and then there is that intense high velocity wind, and then there will be thunderstorm, lightning, intense rainfall, and which can lead to flooding, landslides and mudslides. So what precautionary measures can you take for these? First of all, we all need to stay away from the coastline. So no swimming, no going to the coastline for just fun and picnics. The fishermen need to stay away from the deeper sea. They need to clear off from the coastline. They have to stop their business for the moment. Then those who are living near the coastline, they need to move to higher ground, an elevated area, because in case it hits, then the flooding can go up to 10 kilometers inland. Then we have to stay, if we are outdoors, we have to stay away from the loose items that can fall off from the falling debris. Now what can that be? The tall buildings. With the high winds, they can be damaged and they can fall. The telephone poles, the electricity lines, then the billboards, then the hoardings and all. We have to stay away from these. Even the trees, the ones that are drying up, that are very, very tall, they can sway with the wind and they can even fall. People living on higher areas where there are hills and all, the hills can get landslides and the rocks can roll down, and in the same way, due to the intense rain, the mudslides can occur. So we have to take care of all these things. Then those of us who are indoors, we also have to take our own precautionary measures. We have to stay away from the glasses and the doors. We need to seal them off properly, and we need to secure a place inside the home which is away from these windows. Which places can those be? Those can be the washrooms, they can be the hallways, they can be the basement area. With the high winds, the ceiling fans, they can move, they can rotate, and any structures like any paintings in the house, like any decorations in the house, like any bookshelves in the house, they can all fall. So we need to stay away from these places, from these items. Then as we will be stuck inside, there is no need to go out during this intense rain and everything. The house should have dry ration. Those items, eatable items that are non-perishable, so in case you cannot go out, you can survive on them. They can be those chanas, they can be those dry biscuits, they can be loose cereals which are all cooked and you can just take them on, even cornflakes and everything. You should have the basic supplies at home. There should be clean drinking water available in the home. You should keep rechargeable batteries and torches with the batteries. Please make sure that they are operating well, keep them. Those living near the coastal areas, they should keep waterproof torches if possible. Then keep your phones charged at all the time so that in case of emergency, you can contact someone. Then what else you can do? There are always electricity lines and gas lines within the house. Please stay away from them, because in case of damage to the infrastructure, these lines can also leak and they can be poisoning from the methane gas, from the carbon monoxide gas if you're in the cars. These are all colorless gases, and you never know until you feel delirious and you are totally going out and getting unconscious. Then there need to be first aid kits readily available in the house. The first aid kits should have the basic things to take care of the emergency, like cotton, like some normal saline, like some disinfectant like Dettol or Pyodine, and some bandages, the grip bandages, the crepe bandages and the roller bandages to secure any bleeding or any cuts that have occurred. Then there should be some disinfectant like the Polyfix ointment, and there should be some burn ointments like Bernol and all, that in case of any burns, at least you can cover the area with those until you can seek medical help. Then it should also have some normal saline to wash the eyes or some eye drops. These are the basic things that need to be inside. Then there can be some painkillers like the Panadols or some anti-vomitings. These little things have to be kept in the house. Please make sure of their expiry dates and keep them ready. Then your emergency documents and a little money and all, they should also be ready in a purse, that in case you need to evacuate, you don't have to start fishing out for things and in doing that get stuck inside, but rather you can just lift up that emergency bag and move out if it is required, if your house is falling or something is falling on it and the infrastructure is damaged. Then taking care of all these things can make your life a little bit easier and safer. Then in case there are injuries, bleeding injuries, your aim till you can reach to the doctor and the hospital should be to secure the bleeding. For that you have to first of all put direct pressure. If there is any cloth or anything, keep it on it so that you don't give extra germs to that wound, and elevate that area so that it comes above the level of the heart and the blood loss is minimum, and then tie it up with whatever is available at home till you can secure proper medical help. Then if somebody is unconscious, you have to first check whether they are even breathing or not. Put the back of your hand on in front of the nose so that you can feel the breath coming in and out. If you cannot feel it, if there's a mirror around, you can keep it under the nose and it's going to get smoggy, which means that the person is breathing. So just splash in some water, sprinkle some water and see if the person is waking up. In case they cannot move at all, then do not try to move them unnecessarily, because you never know if there is some damage to the spine or anything. Try to keep them stable and try to call for help. Then those who tend to get anxious and who are vomiting, or who feel that they are feeling uneasy and they can vomit, try to put them in the left lateral position, which is called the recovery position, and put their knees into the stomach, one a little up and one behind. In this way you can manage the little things at home and you can try to help them out and call for help. So please everyone, let us pray that the cyclone does not hit us at all, but in case it does, you are prepared and you can try to keep yourself safe and save other lives also. Thank you. Have a nice day. Allah Hafiz.